KTAR News 92.3 FM. Streaming live on the KTAR News app. It's the Dr. Bob Martin Show.
All right, and we are back, and I hope you had an opportunity this morning to sample or listen in to my nationwide radio show, which I did this morning from 6 a.m. to 9 a.m., the largest health radio talk show in the nation, bar none, and today was a very active day, and if you didn't get a chance to hear that, it'll be in the podcast library over on my website as of this coming Wednesday, by Wednesday, and you can listen to that at drbob.com. That's DOCTOR Bob.com. Always spell out the word doctor, drbob.com, and then remind yourself next Sunday to log on either to my website where you can hear it in live streaming audio right there, or one of these stations that are carrying it, not here in the Phoenix market. So you won't hear it on radio here in the Phoenix market yet, but we're hopeful, and it's on at about 210 other radio stations throughout the country, but all you have to do is log on to my website. It's like listening to a radio every Sunday morning, 6 a.m. to 9, and then we go live here on KTAR from 10 a.m. to 12 noon, and we're happy to be here with you. All right, now, yes, as always, we are wall-to-wall COVID because that's top of mind for everybody, and we'll get back to that conversation, and especially in discussion of another famous athlete dying suspiciously after getting a COVID vaccine, tragically so, and I'm going to get into that when we finish with our special guest. This topic is as important, maybe more important, but yet it ties into this somewhat because if you have less comorbidities or less medical problems in general, you're going to have a better time or an easier time or a more successful attempt to survive COVID, meaning that you hear about people who have had past medical histories of, let's say, heart disease and possibility of circulatory problems, diabetes, high blood pressure, and other problems that leaves them more susceptible to the development of COVID-19 symptoms, worsening symptoms. And we're going to turn our attention now to the area, not because we want to get into the COVID conversation again, but rather talk about something that is with us every year, year in, year out, and that's heart disease, and how you should be able to protect yourself from it if somebody would just please educate you about it. And we have recruited a premier educator. In fact, he's one of my postgraduate training instructors. Our special guest joining us is Dr. James LaValle, internationally recognized heart and immune health expert for over 35 years of clinical experience. He is a clinical pharmacist, author, and board-certified clinical nutritionist. Now, Dr. LaValle joins us today to discuss a new Heart Smart strategy using Kyolic Omega Age. And with that, let us welcome back to the program Dr. James LaValle. Thank you for being with us, Dr. LaValle.
Well, Dr. Bob, how you doing today? Glad to be here.
And I'm so glad and honored to have you back with us, and thank you for taking time out of your very busy weekend to join us. So let's begin right in there. You heard the introduction. You know, staying healthy is primary importance now more than ever. So it's no surprise that more than, and people hear these statistics all the time, more than half of all Americans are taking proactive steps to improve their overall health. We're excited to have you on the show today to discuss some groundbreaking information about a new supplement from our friends over at Wakanaga of America.
Yeah, absolutely. I mean, I think that if nothing else happened over the last year, everybody finally understood the role of the immune system in keeping you healthy, and that when your immune system is chronically under an inflammatory process, it makes you more vulnerable when something occurs like what happened with the pandemic. But it's not just that. It's the fact that, you know, there's this new term called metaflammation. And I know I wrote the book called Cracking the Metabolic Code 20 years ago and kind of alluded to this process, but now it's in the medical literature. Metaflammation equals metabolic inflammation. And when you have metabolic inflammation, that leads to aging. So meaning as your body is moving down this path of being chronically inflamed due to diet, exposures, and stress, and all the stuff that you and I talk about, Dr. Bob, there's this process of trying to quell that fire in as many directions as you can, and that's the Kyolic Omega AGE. I think it's a great multitasking nutrient, and I think it's a real game changer because it's going to help people solve problems.
It is, and it's almost, passive in nature. I mean, if they make zero changes with all of those things that you just mentioned, and I hope they do make those changes if they need to, because it just enhances their health and it reduces their risk. But if they make zero changes and they just plug in something, as you're pointing out, that can help to reduce or quash some of that inflammatory cycle that's there, it takes them out of the crosshairs of those things coming in their directions, all things COVID right now, which is a beautiful thing. And not only that, because we know, everybody knows that heart disease is the number 2 killer after medical miscare. And you don't want to be there either. When we're finished with our interview with Dr. Jim LaValle, we're going to go to open line conversation where you can call in and ask any question you like, open line topics, as well as any question you may have regarding COVID-19 or anything related to it. All right, back to our conversation, and welcome back, Dr. LaValle. Let's talk about this incredible breakthrough coming out of Waukanaga, their Kyolic Omega, this game changer that's making it so easy for consumers that want to get out in front and want to be health conscious, but they don't know where to start. They've all heard and worry about those concerns related to their heart or their skeletal system or their immune system. So can you share with the audience everything you know about it right here?
Absolutely. So the first thing is that it contains aged garlic extract. I know I've talked about that on your show before, but you just have to remember aged garlic extract turns down inflammatory processes in your body. They actually showed this in people that were overweight, that it lowered inflammatory cytokines in their body significantly. It helps to lower blood pressure because it gets the blood vessels to be more pliable, as well as helps to re-regulate the nervous system. It reduces both coronary artery calcification as well as vulnerable plaque, and lowers oxidized LDL a great deal. So it has a wide array of benefit, including even limiting bone loss. So that's the first piece. The next piece is the fact that they use fish oil that's been sustainably sourced. So it's certified by Friends of the Sea. That's a project of the World Sustainability Organization. And that's really looking for clean omega-3 fish oils and being responsible with the harvesting of fish. You get a great ultra-pure source omega-3 from it. And that's important because that helps with reducing triglycerides. It helps with homocysteine, does help with blood pressure, helps with blood clotting, can even help with heart rate. So, a quality fish oil can have a big impact on individuals. So these are combined together, but then it doesn't stop there because it has B vitamins in it, and the B vitamins help to neutralize homocysteine. So for a lot of people, they may not know what homocysteine is. It can build up in your blood when you don't have enough B vitamins. It's a byproduct of your body's methylation processes, partly for detoxification, making neurotransmitters, a whole host of functions rely on methylation. So when you don't have enough B vitamins, you make homocysteine. Homocysteine damages your brain, damages your arteries, damages your kidneys. The last piece to this is that it has vitamin D and vitamin K2. So you're getting immune benefits from the D. I didn't mention the immune benefits from aged garlic extract, but aged garlic extract was shown to reduce the incidence, severity, and duration of colds and flu. But now you've got D and K2 in there, which helps with keeping the calcium in your bones. As we age, when your bones leach calcium, it goes to your arteries. It's absolutely correlated that when you lose bone density, you gain calcium score in your arteries. So really important that you get this comprehensive formula. It's working on the benefits of your heart, oxidizing, reducing oxidized cholesterol, acting as an antioxidant, helping to keep your blood nice and non-sticky, and at the same time helping to reduce the amount of byproducts of metabolic inflammation like homocysteine, like oxidized LDL, like inflammatory cytokines like interleukin-6 that are all out to damage our tissues when we're aging and are leading reasons why we end up with heart disease. 50% of the U.S. population right now over the age of 50, a third of all adults with heart disease. And remember, every diabetic, every pre-diabetic has inflammatory chemistry that leads them to heart disease.
Now, ladies and gentlemen, when was the last time you heard a registered pharmacist talking this sort of talk? How about never? It's the kind of thing that, I fly on long hours on airplanes to hear Dr. Jim LaValle, because you can tell he's armed with information that everyone can use, both lay people like yourself and doctors, physicians, PhDs, you name it. He's one of the lead teachers in postgraduate education. We're both certified through the same organization. And I want you to know what he's talking about here is called Kyolic, spelled Kyolic. They're Omega AGE, aged garlic extract. And if you're looking for that, you can look for it at your local natural health retailer in the greater Phoenix area. I would check it out over at Natural Grocers stores for sure to see if they have it yet. If they don't, they'll get it for you, or any of the other stores throughout the valley. Sprouts, Whole Foods, Vitamin Shop. You're looking for Kyolic aged garlic extract. Their new Kyolic Omega AGE. And we've been talking about Kyolic garlic and Waukanaga products on this radio show for, Dr. LaValle, I think probably going past 20 years now. They're one of our first sponsors.
Absolutely. Well, you know what's amazing is they continue to funnel the research dollars in to show the value of it. Just the latest study showing that it reduced left ventricle mass in diabetics, because when diabetics, their hearts get inefficient, their heart muscle grows, and that leads them to heart failure. They actually showed that it reduced that left ventricle mass in 1 year. That's incredible.
And not only that, we've discussed in the past Dr. Budoff's work, UCLA, and how the Kyolic can not only stop but reverse coronary plaquing in the arteries. Am I not correct on that?
Oh, it's amazing what it can do. I mean, not only the coronary calcification, which is, of course, bad enough, but that it actually reduces vulnerable plaque, which is the plaque that can break off and you can have an embolism or a stroke from it. So reducing that vulnerable plaque. I mean, I've actually seen imaging where the inner lining of the artery was all kind of irregular. They put people on aged garlic extract, and it showed the inner lining or the endothelium normalize after 12 months. Now, I haven't seen anything else do that. And there's certainly not another natural product that I know of that has 870 publications on it and clinical trials with evolving science. So I think it's just, it's a real testament to the natural product industry, what Waukanaga has done with Kyolic and really researching aged garlic extract thoroughly for heart health. And then now immune health. And now there was a study showing that it even reduces gingival bleeding, that it reduces gingivitis, which I think is incredible.
Sure is. Wow. All right. We'll get back to this conversation with our special guest, Dr. James LaValle, in just a moment.
92.3 FM.
All right, our special guest this segment of the program, Dr. James LaValle. He's a registered pharmacist, author, board-certified clinical nutritionist. We invited him on the show today to talk about a heart smart strategy. And, of course, we're talking about the rollout of a revolutionary breakthrough in nutraceutical science, and that's through something called Kyolic Omega AGE, or AGE, which stands for aged garlic extract. The combo of the various ingredients in this formula makes it very unique, makes it cover a lot of ground with your health. And Dr. LaValle, for those people who are just tuning into the program, can you memorialize what is this supplement and what is in it and why does it work so well?
So remember, heart disease is an inflammatory process and an immune-regulated process. So the ingredients that are in omega AGE, aged garlic extract, helps to reduce oxidation or inflammation signaling and helps with balancing your immune system out with its support in the gut as well. There's fish oil that's from a sustainably sourced fish oil that's ultra pure. You won't get the burpy fish taste that you get with cheaper fish oils. And fish oils, of course, are important for lowering triglycerides, which are a big risk factor for heart disease, as well as helping with blood vessel health and keeping your blood to be less sticky. And then the third component is the B vitamins that are in it. And the B vitamins are in it to support homocysteine, meaning that you want to lower your homocysteine levels. The higher your homocysteine, the more your risk for damaging your arteries, your brain, and your kidneys. And so the B vitamins help you to recycle your homocysteine back to the amino acid methionine, and which is a really important cycle because it's involved in what's called methylation, which is involved in a multitude of reactions in your body. And then the last piece is the fact that it has vitamin D and K2 in it. The reason for this is we're trying to keep our calcium in our bones. When you lose bone density, you gain calcium in your arteries. So the K2 helps to keep the calcium in the bones. And there's actually studies showing, Dr. Matt Budoff showed this, that it actually helps with aged garlic extract, also helps to keep the bone from losing calcium, and people that already have coronary artery calcification. So pretty significant finding on these ingredients. And what basically it's doing is it's multitasking. It's working on your blood vessels. It's working on oxidation of lipids. It's lowering your lipids. It's helping to improve the bad actor lipids. It's helping with stickiness of your blood. It's keeping the calcium in your bones. It has a lot of different benefits, all built into one great product.
Very impressive, Dr. LaValle. I want to thank you for being our special guest today, and I want to remind our audience again where they can find what you're talking about, Kyolic Omega AGE, which stands for aged garlic extract. Kyolic Omega AGE can be found at finer health food stores. Look for it at your local health retailer in the greater Phoenix area, natural grocers, and other stores. They also have a website. You can visit their website, kyolic.com, KYOLIC.com. That's kyolic.com for the supplement Kyolic Omega AGE. Dr. LaValle, thank you so much for joining us, and have a good rest of the weekend. We look forward, sir, to talking to you in the very near future.
That's great, Dr. Bob. Thanks for having me.
Thank you again. All right, there he goes, Dr. Jim LaValle.